Benzodiazepines are a class of medications that act as a central nervous system depressant. They have a wide variety of uses, including anxiolytic effects, or to relieve anxiety, as anticonvulsants, or to manage seizure disorders, as a hypnotic, for insomnia, as an anesthetic, and to treat withdrawal syndromes. They act by enhancing the main inhibitory neurotransmitter gamma-aminobutyric acid, or GABA, by binding to its receptor. It's pretty well established that your brain's really important. It controls your feelings, your movements, your sleep, your memory. It controls everything, whether you're aware of it or not. The cells that make up our brain are called neurons. Neurons communicate with each other through neurotransmitters. When one neuron is stimulated, it'll release excitatory transmitters like glutamate, which bind to receptors on the next neuron. This causes the next neuron to depolarize and release its own excitatory neurotransmitters, propagating the signal throughout the brain. Now we have inhibitory neurons that will shut down this chain of events. These neurons release the main inhibitory neurotransmitter in the nervous system, gamma-aminobutyric acid, or GABA, which binds to GABA receptors on other neurons. These receptors are large, multi-unit complexes that form ligand-gated ion channels, which open up to let chloride ions into the cell. The influx of negatively charged ions causes hyperpolarization, where the cell's membrane potential becomes more negative, which means it's more difficult for it to depolarize and fire off an action potential, and that means is less responsive to stimuli. Now, there are cases where neurons in the brain start sending out more excitatory signals than normal. This can occur due to either too much excitation by the excitatory neurotransmitters or too little inhibition by the inhibitory neurotransmitters like GABA. Excessive excitatory signals can cause psychiatric disorders like anxiety and neurological disorders like seizures and epilepsy. Okay, so one way we can decrease the excitatory signals is by enhancing the effect of inhibitory neurons through medication like benzodiazepines. They are composed of a benzene ring that consists of 6 carbon atoms fused to a diazepine ring that is made up of 5 carbon atoms and 2 nitrogen atoms. They can be roughly divided into the long-acting benzos, like diazepam, chlordiazepoxide, and short-acting benzos, like midazolam, alprazolam, lorazepam, oxazepam, and temazepam. These medications target the GABA-A receptors, but they bind at a separate site than GABA. When both benzodiazepine and GABA bind to their separate sites on the receptor, the chloride ion channel opens more frequently and increases the intracellular chloride level. Now, a similar group of medications called barbiturates also function by binding to GABA-A receptors. The important distinction is barbiturates cause the channels to open longer, and unlike benzodiazepines, they can cause the channels to open even in the absence of GABA. Alright, so benzodiazepines are indicated when the neurons get super excited, and we want to calm them down, like in anxiety disorders or during a panic attack. Benzodiazepines are also very effective anticonvulsants, and are considered the treatment of choice for status epilepticus, which is when a person has over 5 minutes of ongoing seizures or multiple seizures without returning to a normal state in between. Certain benzodiazepines are also used for anesthesia, since we basically want to depress the function of the patient's nervous system. For the same reason, they are an effective treatment for insomnia, but they decrease REM sleep. Since alcohol and barbiturates also work by targeting GABA-A receptors, benzodiazepines can be used to manage their withdrawal symptoms by decreasing their severity. Finally, they are sometimes used as muscle relaxants to treat spasms, like those caused by cerebral palsy. Moving on to side effects. Benzodiazepines can have some adverse effects even when used at therapeutic levels. And that's when it's combined with alcohol or other medications that depress the nervous system, like barbiturates and antihistamines. The nervous system depression can get even more severe. That said, benzodiazepines have relatively fewer and less severe side effects when compared to barbiturates. These include drowsiness and decreased concentration, problem-solving abilities, and reaction time. Due to this, they should not be taken before driving. Despite being a central nervous system depressant, benzodiazepines can cause paradoxical stimulation in certain parts of the brain, leading to symptoms such as fast speech, excitement, and restlessness. The good news is that overdose can be managed with flumazenil, which acts as a competitive antagonist for benzodiazepines, which means that it binds to the same site as benzodiazepine and blocks its action. When used chronically, a person can develop tolerance to benzodiazepines, and their effectiveness decreases. which means they'll need to increase the dose to get the same effects. This is problematic because benzodiazepines are habit-forming and could lead to addiction. Chronic use also leads to dependence, which means when the medication is discontinued, the person experiences withdrawal symptoms, like insomnia, anxiety, and seizures. This is less likely to happen when compared to barbiturates, making benzodiazepines the preferred choice. Surprisingly, the treatment of choice for people with benzodiazepine withdrawal is more benzodiazepines. Now, let's make a simple and fun mnemonic that'll help you efficiently memorize these pharmacology facts. So first, let's start with a large dorm room, and hanging from the ceiling are 2 interlocked rings, which represent the benzene and diazepine ring that make up the benzodiazepines. Now, 6 students live here, which means there's quite a lot of people coming and going, so the door, representing the chloride channel, opens frequently. Each of these guys represents one of the indications for benzodiazepines. First, there's a 3-level bunk bed, and the student sleeping soundly on the top bunk represents their effect as a hypnotic. On the next level, there's a student who's undergoing surgery, which represents their anesthetic effects. The student on the bottom bunk is having a seizure to help you remember that they are anticonvulsants. Now there's also a long desk with 3 students. One student is having an anxiety attack as he studies for his test, so benzodiazepines can be used as an anxiolytic. His buddy is getting a massage, which represents their muscle relaxant properties. And finally, his other buddy is tossing away all his alcohol, since benzodiazepines can be used to treat withdrawal symptoms. Okay, now these guys are having some lady friends over, and they represent the side effects. First, there's a girl dozing on the sofa, representing drowsiness. Next to her is a girl having trouble with a Rubik's Cube, which represents the cognitive effects like decreased problem-solving abilities and concentration. One is talking quickly and excitedly on her phone, which represents paradoxical stimulation. The last girl is hanging up anti-drug posters, since benzodiazepines can lead to addiction. There's a whiskey bottle surrounded by barbed wires in the trash can to help you remember these medications should not be taken with alcohol or barbiturates, since their depressant effects are additive. Alright, as a quick recap, benzodiazepines are central nervous system depressants that function by enhancing the actions of GABA, by letting the chloride channels open more frequently. They are widely used as anxiolytics, anticonvulsants, and anesthetics, and for the treatment of sleep disorders, muscle spasticity, and withdrawal symptoms. Benzodiazepine overdose is relatively safe when compared to barbiturates, and can be managed with flumazenil, which is a competitive antagonist for benzodiazepines. When used for a long period of time, they cause tolerance and addiction. If they're discontinued, it could trigger withdrawal symptoms. But wait, there's more! Here's a mind map with all the mnemonics from the video. Go ahead and pause the video so you can test yourself to see what you remember. Stay tuned for the answers at the end.